Health authorities have just shared a new measure aimed at addressing the latest rebound in the country's COVID-19 caseloads. For details on that, I have my colleague YOO-JIN standing by. YOO-JIN, do start us off.
Well, Sunny, the biggest change is in the country's vaccination scheme. Previously, the second booster was only advised for those aged 60 and older, as well as the immunocompromised. But the Central Disaster and Safety Countermeasures headquarters says that it is now being rolled for people aged 50 and above, as well as those 18 and older who have underlying health conditions. The government will also work to increase the vaccination rates at facilities for the disabled and the homeless. And to effectively treat people who are critically ill, health officials will secure more sick beds for a maximum 200,000 patients. And for those who are receiving treatment at home, they will increase the number of the so-called one-stop COVID-19 treatment centers to 10,000 by the end of this month. Now, these one-stop treatment centers provide COVID-19 testing, treatment, and prescriptions all at once. And as of early this June, there were about 6,200 of them. And finally, the mandatory 7-day quarantine for those who return a positive COVID-19 test will stay. While stricter social distancing measures will not be imposed this time, circumstances may change depending on the country's virus situation.
Right, YOO-JIN, and talking about the country's virus situation, what can you tell us about the daily tally on this Wednesday?
Well, South Korea saw 40,266 new infections as of Tuesday midnight. That's more than double the figure reported at the same time last week, and is the first time in more than 2 months that the tally has topped 40,000. There were 12 related deaths, and there are 67 critically ill patients. That's all I have for now. Back to you, Sunny.
All right, YOO-JIN, thank you for that. That was our YOO-JIN with the latest on the COVID-19 situation here in South Korea.